Welcome to Lamb Hospital, and thank you for this opportunity to tell you a little bit about the hospital. It's a privilege to have this opportunity to talk to you as long-time supporters of Lamb. As some of you may know, Lamb Hospital opened its doors the first time in 1983, which means that in October we are celebrating 40 years of this hospital in this place. Throughout the years, we've tried to provide high quality healthcare within appropriate technology with a focus on women and children, and especially the poor.
Lamb Health has been a wonderful support to us throughout the years. As far as the hospital goes, it was mainly our poor fund that gets supported in a great part by Lamb Health. Poor Fund has kind of two bits. There is just the privilege that we have that we can treat our patients without worry about the cost, which means that patients get the necessary treatment and then they can apply for subsidy if they cannot afford the bill. And then the other part is the PI program, which means poverty index, where in the community we are evaluating all pregnant women, and the women that are eligible and are categorized as very poor, they get a card, and with that card they can either get free treatment at Lamb and at our safe delivery units, or they can get it at a very low rate, a fixed rate that they know in advance. And in that way we try to encourage them to have institutional deliveries either in the safe delivery unit or at Lamb, and to not wait to get treatment for their child until the child is 2 years old. In the past years in Bangladesh, there has been a trend where the government is encouraging people not to have home deliveries, but to have a delivery in an institution, either a safe delivery or a family welfare center, or a private clinic or a government hospital. And with that trend has come that the patients are encouraged to have cesarean sections instead of trying for a normal delivery. We at Lamb advocate to have a normal delivery in any time that it is safe to have that, because we feel that having a cesarean sections without a good indication increases the risk for the mother, especially in consecutive deliveries. So in the later deliveries, maybe the first child is not a problem, but once a woman has the second but third cesarean section, then we see problems. So we are advocating in our community and in our antenatal clinic, trying to educate patients and trying to get them to see that having a normal delivery is better than having a C-section unless there is an indication. Our neonatal unit is one of the places where we advocate appropriate technology, where we're trying to have low-cost solutions to save as many lives of babies as possible. One of the ways we do that is by kangaroo mother care, where the baby gets nursed on the chest of the mother or of a close relative with skin-to-skin contact. This means that the baby gets the stimulation of the breathing of the mother and gets kept warm by the warmth of the mother, and also has close monitoring, as the mother can feel any changes in breathing that the baby has. We are not able to ventilate patients on a ventilator, but we do have CPAP, a way to increase the pressure of oxygen that is delivered to the baby, and helps them, supports their breathing basically. So the baby needs to breathe by itself, but it gets extra oxygen. As I have shared, our focus in the hospital is on mother and child care, and our gynecology and neonatal units are the largest units of the hospital, but we do have all main specialties. So we have a medicine team that is run with 3 Bangladeshi seniors. At the moment, we do not have an expat medicine doctor. They see general medicine patients. In Bangladesh, we're seeing a rise in non-communicable diseases, which are diseases like lung problems, COPD, asthma, high blood pressure, heart problems, and diabetes. And we are trying to get patients to come back and have their regular medication, educate them that with hypertension you cannot just take the medicines and stop them again when you're feeling better, but that is long-term treatment. Besides the medicine team, we have a pediatric team that sees the neonates, but also sees general pediatric patients. I should mention that the gynecology team, which is a very solid team with 6 senior Bangladeshi doctors, does the obstetric care, but also does general gynecology with operations, and also focus on vesicovaginal fistulas, which some of our seniors are operating by themselves, and then we have experts coming from outside regularly to help us to operate the more difficult fistulas. These fistulas happen after difficult deliveries, but what we're seeing more and more is that they happen after surgeries like cesarean section and hysterectomies that are done by unskilled doctors and are causing damage to the bladder and or the urinary tract. We are grateful to someone like Christine Edwards, who has been a long time LAMP doctor and is still supporting us with helping to operate the vesicovaginal fistulas. Besides the medicine, pediatric, and gynecology team, I work as a general surgeon and have a small team to support me with general surgery. One of the things that is new this year is our palliative care team. This is a team consisting of a medical assistant, Sarah Fisher, one of our expat nurses, one of our labor room maternity ward nurses, and a nurse's aide. This group is available to talk with patients and their relatives after they receive a diagnosis that no longer can be cured. Mostly we're talking about cancer in that case, but there are some people with severe lung or heart problems who are in the same situation where they're facing the end of life. This group can take the time to talk to them and their relatives about their worries, explain the situation more clearly, and then they also have the option of treating some of the symptoms that may occur. They have done a palliative care course that is a relatively short course, and this gives them the tools to suggest things that may improve the journey towards death. They also have the opportunity to do this in home visits, where they can meet the patient in their home situation, and in that situation even better are able to discuss the things that a patient would still like to be able to do before they die. Another thing that is new is that we have started evening clinics in the past 3 months. This is a combination of factors. It is an opportunity for our senior doctors to earn an extra income, and at the same time it is an opportunity for more well-off patients to come to the hospital at the time where there are less crowds, they can come outside of their own working hours. This is a new thing, and we're still working out to see if it's something that we should continue, but up till now, especially in the gynecology side, it seems to be a way to generate extra income for the hospital as well. We will continue to monitor this to make sure that it's actually generating an income and not costing us. In our hospital, we have hospital chaplains who are available in the outpatient department for anyone who wants to walk in and ask questions. They can explain more about Jesus or discuss anything that people want to talk about and want to be prayed for. They hold a morning devotion every morning that is broadcast over all the wards of the hospital, and at the end of the day they show the Jesus film in the hospital waiting area. Besides that, the hospital chaplains visit our patients mostly once a day, and they can talk to patients, hear their worries, and also offer to pray for them. We want in our hospital to share the light of Jesus with our patients. We would love for every patient who comes into contact with us to somehow realize that Jesus has died for them as well. And our chaplains are a great way to help us spread that love. We want to again say thank you to you at Lamb Health for the support that you've given us throughout the years, financially, but also through prayers and just through your interest in our work here. Thank you for that. We would love to extend your love for Jesus to our patients as we see them and treat them in a way that is high quality and appropriate technology and appropriate cost, and that we can your help is a great help for us to be able to also extend that to the poorest of the poor. Thank you for that, and God bless.